Archiving started.
We are going to review cardiac function and gastric function. Starting with cardiac enzymes of importance. We look at cardiac enzymes to see if somebody has had a myocardial infarction or a heart attack. The first important protein I will point out for cardiac function is troponin. Troponin is very specific. We find it that comes in three different types of proteins: troponin T, troponin C, and troponin I. Troponin T and troponin I are very cardiac specific. Troponin I is what I have used in the labs that I've worked in, but troponin T is also becoming very useful. Troponin C, while not widely used, contains that plays a main role in calcium regulation and muscle contraction. Troponin rises within 4 hours and stays elevated for 7 to 10 days. Very specific, rises very fast, stays elevated for a very long time. Myoglobin is an oxygen-binding heme protein found in cardiac and skeletal muscle. He'll rise in 3 to 4 hours, but falls very quickly in 24 hours. He's not very specific, and he can be found in muscle injuries as well. So I always use the example of the person who got in a car accident and died. Well, does he have a high myoglobin because he had a heart attack and hit something, or does he have a high myoglobin because he had a car accident? So it's always hard to tell with myoglobin. Injuries can make it high as well. So troponin would be a much more specific choice. CKMB is an isoenzyme of CK. It's found in heart and skeletal muscle. So the MB of whether they had a heart attack as well. Now this rises in 4 to 6 hours and stays elevated for 2 to 3 days. This one is known to elevate the fastest and actually elevates a little faster than troponin, even though it says troponin rises within 4 hours as well. Lactate dehydrogenase 1 and 2 are found in heart and liver. It elevates in 12 to 24 hours and stays elevated for 5 days, but it's not very specific because it is found in a variety of other diseases as well. Usually when a patient goes into the emergency room, they will be tested for a troponin and a CKMB. Another test I'd like to make note of here during the cardiac section is congestive B-type natriuretic peptide. When somebody has congestive heart failure, it puts excess pressure on the heart. That excess pressure causes the myocytes in the heart to stretch, and when those myocytes are stretched out, we have natriuretic peptide into the bloodstream. So therefore, it is an excellent indicator of congestive heart failure. Moving on to some gastric type tests, let's talk about the pancreas. The pancreas is my favorite organ to talk about because of how much it actually secretes. It secretes 1.5 to 2 liters of fluid a day into your duodenum. Think about it. That's like one of those whole giant Coke containers, like a big 2-liter bottle of soda. It's that little in your intestines. So it's completely crazy to think about. The pancreas is a very large gland. It lies just outside the GI system, and it's got endocrine and exocrine components. The endocrine components are things like insulin, which allows our glucose to go into our cells. That's the only one that decreases blood sugar. Glucagon increases glucose in the blood. Gastrin secretes gastric acid secretion, so your stomach spews out more acids and starts breaking down foods. And somatostatin inhibits secretin, which we'll talk about here in a second. So some other things that it also secretes: secretin, which causes the production of bicarb-rich pancreatic intestines. So you think about it, your stomach is spewing all of these acidic chemicals out into your intestines. Well, if you have secretin, it would allow that bicarb-rich pancreatic fluid to neutralize that pH a little bit. Cholecystokinin is produced by the cells of the intestinal mucosa and is responsible for release of enzymes by the acinar cells in the pancreas, and also allows for intestinal motility. And we need that for things to move along. Vasoactive intestinal peptide, also called VIP, is a neurotransmitter that relaxes smooth muscle in the gut and increases water secretion. We also have some exocrine. They're rich digestive fluids with enzymes in the acinar cells. That lines the pancreas, And that's what secretes that 1.5 to 2 liters of fluid a day, which is just crazy to think about. This is with the gastric issues. A person with cystic fibrosis would have an inherited autosomal recessive disorder characterized by dysfunction of mucus and exocrine glands throughout the body. In order to test for sweat chloride, this is where we collect sweat by pilocarpine administration by ionophoresis and test the sweat for chloride. This would give us an indication of whether they have cystic fibrosis. They would have a lot of chloride, actually. If you have a dysfunction of mucus and things throughout your body, you would have things plugged up, so it's very difficult for them to absorb nutrients and things. Pancreatitis is caused by an autodigestion of the pancreas as a result of the contents into the pancreatic duct. With this, we find an increased serum amylase and lipase. H. pylori can cause problems. He's a bacteria that invades the stomach and causes ulcers. We can do a urea breath test for that, or you can take biopsy. And now we can even do an enzyme immunoassay on blood to look for H. pylori. Celiac disease is an autoimmune disorder produced by gluten, wheat gluten, and we find damage to the intestinal lining cells and malabsorption as well. Zollinger-Ellison, this one sounds really painful. This is where we find gastrin levels of 2,000 times normal. This occurs from pancreatic cell tumors called gastrinomas that overproduce gastrin. When you overproduce that gastrin, you overproduce stomach acid. With this, you get diarrhea, steatorrhea, ulcers, and hyperacidity. Sounds very painful. So in a review of some of the testing that we do, it's very common for pancreatitis. Amylase usually 26 to 122 units per liter. Lipase should be 10 to 73 units per liter. And lipase, they say, stays increased a little bit longer than amylase. We can do a test. This one, if you drink xylose solution and they draw your blood for it, if it does not show up in your blood, then they know that it's a malabsorption issue. We look at the and try to diagnose any nutrition-related disorders. There's different things that they look at. You usually have a nursing care provider who goes and looks at the assessment, diagnosis, does intervention, and monitoring and evaluation of diets to see if they have some of these issues. I threw metabolic syndrome in here as well because this is kind of important to be familiar with. Somebody is considered having metabolic syndrome if they have these issues. A waist circumference in a female of greater than 35 inches, a male greater than 40, triglyceride levels greater than 150, glucose greater than 100, HDL less than 50 in women, less than 40 in men, and a high blood pressure of 130/85. So you could determine if somebody had metabolic syndrome if they had those types of things going on. If you look around our society these days, quite a few people probably fall into that category.